Artificial intelligence and technology are being used more and more in healthcare. Is there a place for it to help caregivers? This is something that we'll be discussing during this presentation, which is made available through the Caregiver Teleconnection, a program of the Caregiver SOS at the WellMed Charitable Foundation. The Caregiver SOS provides support and education for family members and friends who are caring for an older loved one. We'll provide all of their contact information at the end of our presentation. My name is Elliot Sklar, and I'm here today with my longtime colleague and friend, Lucy Barylak. I am a professor of health science at Nova Southeastern University in Florida. After I received my doctoral degree in public health, I went on to work with seniors and caregivers in community settings in addition to teaching, which I've been doing for about 20 years. A focus of my work has been to promote healthy behaviors around diet, exercise, and also around caregiving, especially as it relates to groups of people who have challenges with their health, and that often occurs among caregivers. I've published and presented research on caregiving internationally.
Thank you, Elliot. Hi, everyone. My name is Lucy Barylak. I received my master's degree in social work at McGill University, and I dedicated my career in supporting caregivers. I was involved in several research projects to develop services and identify what our caregivers need. As well, I also co-edited several books and published numerous articles in journals. I received the Queen's Jubilee Award from the Canadian Home Care Association for developing a national coalition to support caregivers across Canada. Presently, I'm a supervisor at the School of Social Work at McGill University. But most important, I was a caregiver for my mother for many years.
Thank you. Telehealth and artificial intelligence, sometimes known as AI, are transforming healthcare by enhancing the role of caregivers, especially those caring for seniors. These technologies are offering practical solutions that help to improve communication, monitoring, and support, also helping caregivers manage daily responsibilities more efficiently and effectively. This program will provide an overview of their role, along with examples of tools and apps that can assist caregivers, particularly those for seniors and those with Alzheimer's and dementia. It's hard to pack a lot of information into a short presentation, so our goal is to orient you to the kinds of ways that telehealth and AI are being used to support caregivers, allowing you to further explore on your own.
Many people feel uncomfortable with technology, especially in combination with healthcare, which can at times be uncomfortable too. But during the pandemic, many of us had to give up, had to rely upon telehealth visits or using technology in a way that we haven't before, like those Zooms, get-togethers, and happy hours that many of us did. Technology isn't going anywhere, and there can be a helpful place for it in supporting the role of caregivers. And sometimes we think of technology as separate from human interaction, but we need to think of the examples I just provided or ways the technology can bring us together, especially for caregivers who may be isolated and without respite. It might be a good time to bring those video calls, visits back to our lives.
Yes, and that is true also during wintertime and flu season. A lot of people right now are sick across the country and wearing masks, I see when we're out. So that is a great option, certainly. There is a role for telehealth and for AI. And let's first discuss what each of these are. So, telehealth or telemedicine enables caregivers to connect with healthcare professionals remotely, reducing the need for in person visits, which can be challenging both for seniors and caregivers. Those kinds of visits that Lucy was speaking about during the pandemic. This technology helps caregivers in a few ways. First is accessing medical advice and support from doctors, therapists, specialists without leaving home. Also, monitoring health conditions of people remotely using devices like blood pressure monitors, glucose meters, and pulse oximeters that help transmit healthcare data to healthcare providers. Also, regular check ins can be possible through video calls or messaging, uh, even for prescription refills, which can reduce the burden on caregivers by helping to ensure that that the health of a care recipient is being monitored properly. Now, artificial intelligence, sometimes called AI, also plays a pivotal role in caregiving. Now, more and more, it's being used to automate tasks, improving monitoring and enhancing decision making. So AI helps with medication management. As an example, AI-powered devices and apps can remind seniors when to take medications and can also track prescriptions and provide caregivers with updates if a dose is missed. There are intelligent monitoring systems with AI algorithms that can detect changes in behavior, physical activity, sleep patterns. These are those devices like watches and rings that you might see advertised. They can help to alert caregivers of potential issues like falls, even anxiety, increased heart rate. And then there are also personalized care suggestions. And AI can help to analyze data from sensors, wearables. So these apps and devices that I've been talking about that can also make recommendations that are tailored to someone's health. So we're seeing this already in smartphone integrations, actually, that allow you to track your steps. The watches that I mentioned and rings that help to monitor your pulse, blood pressure. There are watches that can even do a very simplistic type of an EKG. Um, Another example, I have a smart scale that tracks 27 different health indicators, including my hydration level on my phone. And it's something that I do use to share with my doctor. So these things are becoming more and more common. You may have also heard about artificial intelligence in the form of things like ChatGPT or Microsoft Copilot. So, ChatGPT, just as an example, is a website that you can use or an app if you download it, and you can use it to ask questions about almost anything, helping to choose a restaurant or asking about contraindications to a list of medications that you may be taking and their side effects. ChatGPT can serve almost like an encyclopedia if you know how to prompt it with the right questions and if you ask it, and this is very key because a lot of people wonder, how do you know if the information is correct? So ask it to include references and citations so that you can double check the accuracy of what it's sharing. ChatGPT can also help caregivers to be provided with timely information. It can help, for example, to organize medical files and questions and even chronology of things. You can ask a lot of questions, for example, that you would to a doctor. So I put into ChatGPT just as an example. My husband was diagnosed with Alzheimer's disease 2 years ago. What questions should I be asking his neurologist at our upcoming annual visit? And that's sometimes a really good question that many people don't really have a handle on what they should be asking. So, what did ChatGPT say? It said, I'm so sorry to hear about your husband's diagnosis. It's important to stay well informed and proactive in managing Alzheimer's. So, preparing for your upcoming visit is a great step. Here are some thoughtful questions you might want to ask. So, it breaks them down. Number one, disease progression. How is my husband's condition progressing? What stage of Alzheimer's is he in now? And what can we expect in the next year or two? Are there any changes in his symptoms that we should be watching for? Are there any tests or scans that could help to monitor his condition more effectively? Then it also breaks down treatment and medications. Are his current medications still the most appropriate for his stage of Alzheimer's? Should we consider any adjustments or changes to his medication regimen? Are there any new treatments or clinical trials that could benefit him? And how do his medications help with symptoms? And are there any side effects that we should be watching for? And then a last category is monitoring and adjustment. How often should we be scheduling checkups or follow up appointments? And what are the signs that we should call you, the doctor, between visits? So I think that these are some really excellent questions, actually. And I love that it also suggests that it's helpful to write down your husband's current symptoms, behaviors, and any challenges you've noticed since the last visit. This can give the doctor a clearer picture of how he's doing. Would you like any specific tips on preparing for the visit or strategies for managing daily care? So this is just one example of using ChatGPT to ask a typical caregiver question. And we were really quite impressed with the response that it provided because I think it gives a lot of good ideas for questions that you could be asking a provider at a next visit.
Thank you for that, Elliot. You know, the key for many people is how do I use and access these technologies and apps? Well, there might be one good way, as Elliot said, with Chat GPT to help you. You can ask it about specific apps and technologies to help you with your specific needs, as well as interactions on how to find and use these technologies. It will actually provide step-by-step instruction, which is quite easy. We used to think of asking Google, sorry, to help us find things, and artificial intelligence is just helping in making those searches more specific and tailored. This is why Google and Apple Siri are using artificial intelligence. Amazon also has products to help caregivers like pill locker and dispensers, pads for the bed that can alert you if someone has gone out of bed, and the motion detection video cameras. Our smartphone can also be used to as reminders, medication alert, and to track our health information. If you go online and search for free caregiver technology courses, there are so many resources that come up, and they're very helpful.
They are very helpful and they're always evolving, they're always new ones. So, we did want to provide some examples of some of the tools, apps, and technologies that we've been speaking of in different areas. So, and again, these are always changing. These are just examples. And if you go to the App Store on an iPhone or an Android device, you'll find, if you look up free caregiver programs, there will be many of them. But one of them that's very, very helpful is medication management and health monitoring. So, MediSafe is one example of an app that's designed to remind seniors when it's time to take medication. It also provides alerts and notifications to caregivers if a dose is missed. Now, it tracks medications, dosages, and schedules, and even provides warnings about potential interactions. Now, it does this with the combination of one of these locked pill boxes that we were speaking about. I'm sure everyone has heard of Philips as a company. Philips Lifeline is one app as well. They make a wide variety of health products, including wearable devices that link with emergency response services, which is quite unique. So that can alert emergency medical response if a fall is detected, for example, or alerting a caregiver if that's your preference. There are also AI powered monitoring systems like Grand Care, and it's a platform that integrates sensors, video communication, and emergency alerts. So it gives caregivers the ability to monitor the daily activities of their care recipient. It tracks movement, vital signs, and health conditions remotely, which can be very helpful. Another is called Care Predict, which uses AI and wearable devices to track daily activities and also behavioral changes. It can notify caregivers about potential health issues, including falls, issues with medication adherence, or changes in routine that could signal the need for a check in terms of cognitive health. This is another app related to communication and social support that we've talked about in some of our caregiver teleconnection programs, and it's called Papa. Papa is actually an app that was developed here in South Florida to help seniors learn about technology, and it's evolved now to connect people with what are called Papa Pals. They assist with companionship, like housekeeping, technology if you need it, also running errands. It's a great option for caregivers who need a little bit of help or respite. You can also make video calls and use social media in a helpful way. I think that that's important for caregivers who may be feeling isolated. It's important to use these things thoughtfully, but social media also has sites that are dedicated to providing resources and support for caregivers. And we hear often how helpful certain Facebook groups are, just as an example. So, those are some very important resources that you can use on your own through devices, which we all have typically in our pocket. So, some other apps include cognitive health tools for Alzheimer's and dementia. So, for caregivers of individuals with Alzheimer's or dementia, there are many tools that help to address memory loss and cognitive function. And one of them is called Memory Care. It's similar to another app like CogniFit. And these are brain training games that anyone can use actually to help improve our cognitive function, but they're particularly helpful for people with early stage dementia. There are also Alzheimer's caregiving apps designed by the Alzheimer's Association, and their app offers resources, guides, education, um, even resources for grief. And there are a lot of apps that our care giver participants in our teleconnection programs have recently spoken to about anticipatory grief and how helpful these apps can be. There are also online courses. Now, anticipatory grief refers to the mourning that people can experience before the loss of a loved one. And it's very common among caregivers of people with chronic degenerative conditions like Alzheimer's disease. Some apps are designed to help caregivers cope specifically. One of them is called My Grief Angels, and it connects caregivers with others who are experiencing similar losses. It also provides some coping strategies and online support groups. And there's one on grief called Support for Loss. And though it was created by the American Cancer Society, the app is helpful for anyone. It's not dementia specific, but it can be used by any caregiver, especially those experiencing anticipatory grief. The nice thing about these apps is that they're also private because you access them from your phone and when you're available. And this way, you can do it discreetly, so you can share your feelings or engage with others when you're available. There are additional tools for caregivers of seniors with Alzheimer's and dementia. And again, these are just some examples. One is called Remo Health, and that is incorporates a wearable device that tracks the movement of a loved one. So again, it can help to detect a fall, a lack of movement, or if someone wanders. There's one called Memo, which is LifePod's AI-powered virtual caregiver. There's so many different apps now, it's amazing. But they can, again, keep track of schedules, medication, reminders. The nice thing about this one is that it uses voice commands, and it's especially helpful for seniors with dementia because it provides some gentle prompts to them using voice to help remind them of certain activities. And one is called Lively by Great Call, and this is a wearable device that links with emergency services, health tracking, and I love that medication reminders are really well integrated into all of these technologies. They're so helpful for people who have cognitive impairment.
Thank you, Elliot. Telehealth and AI technologies are rapidly changing the landscape of caregiving for seniors, providing valuable tools that help manage health conditions, track well-being, and improve the overall caregiving experience. From medication management to AI-powered behavioral monitoring, these tools support caregivers in managing the complex daily tasks and emotional challenges. Caregivers of individuals with Alzheimer's or dementia benefit from these innovations, as many of these technologies focus on safety, cognitive health, and managing the emotional burdens of caregiving, including anticipatory grief. Technology can also allow us to access learning and support through community. There are many online caregiver communities that can be so helpful um, in all your experiences of caregiving and giving them a dedication space that you can share with others. As the demand for elder care grows, it is likely that the role of AI and telehealth in caregiving will expand, offering even more personalized and comprehensive solutions to improving the lives of seniors and their caregivers. So it's all the more important that we start using these technologies to become more comfortable with them and to reap their benefits.
I agree completely. And I think it's important also, as you said, that we recognize that technology doesn't have to mean that it disconnects us from people. If anything, it can be the opposite, especially for caregivers who might not have respite available. Technology can be a great way of having video calls and linking us with other people and other family members. And some caregivers actually make a practice of doing that with their care recipient, having family video calls once a week. That way that allows their care recipient to see extended family members that they wouldn't otherwise have access to. So there are a lot of great tips and tricks, and I hope that we have shared some good ones. We have some other resources that we do want to share because they're very important in terms of how you can learn more about technology as a caregiver. There are online caregiver communities, and we've provided one through Caregiver Action, the Caregiver Action Network, another through the AARP, and also the Family Caregiver Alliance. Now, a lot of people ask, where can we learn more about technology? And there are webinars and online training through the National Institute on Aging, and we've provided anything that you see here with an underline is a website. We've provided their link. And caregiving.com actually has some great tech tips and recommendations. There are also technology specific websites. One is Aging in Place Technology Watch, which is very helpful, and it focuses on smart home and assistive technology devices to help adults live independently and age in place as long as possible. And that can be as simple as lamps that you can control with your voice and plugs. So there's also Tech Enhanced Life, which is a blog that helps to explore innovative technologies that help caregivers. We have some more resources still. Assistive technology product categories. These are really great, and Lucy and I thought that they were very important to include because many people aren't sure what technologies and solutions exist to help people with specific disabilities and their caregivers. And these two resources come from organizations and an educational institution that have no profit that they reap from anything that they recommend. So you know that what they recommend is without bias. The Center for Assistive Technology can be found at the website here through Buffalo University, the University of New York at Buffalo. And then there are also Assistive Technology Industry Association, ATIA.org. They have an extensive catalog of assistive technologies specifically for caregivers. It's an amazing, amazing resource. Then finally, we have some caregiving apps that people find very helpful. CareZone is one that helps to organize health information, medication, appointments, and Lots of Helping Hands is another platform that's very helpful if you have family or other people that help you to coordinate your care for a care recipient. It can include sharing of responsibilities, for example. And Red Beacon is another one that also helps with home safety. Finally, there is a caregiver support organization through the Alzheimer's Association. And as we mentioned, the Caregiver Teleconnection. which you can find online through caregiversos.org. And if you want to reach out to someone that you can speak with directly, you can give them a call at 1-866-390-6491. We also have links here for the YouTube channel from the WellMed Charitable Foundation, where you can find additional recorded programs. And if you have questions or want to be added to the email distribution list for upcoming programs, you can email caregiversos@wellmed.net. We want to thank you so much for participating and watching our program today, and hope that this information was helpful.
Thank you so much, everybody. And what I have to share with you is don't be afraid. Try it out. Take
Great
care.
advice.